So I was very studious in my studies towards the end of the high school career, because I was studying with a vengeance, so that I wanted to enter the medicine speciality. Now, in those days, there was no medical college in Kerala, in Travancore state. It was Travancore state. So the Travancore state had 4 seats in the Madras Medical College, in Madras University. So we got selection for that seat, and we started the course in 1949. So 49 to 54, 5 years. So we completed the course in record 5 years without losing any year or any subject, completed in 5 years, and 54 we graduated from Madras University. Immediately we entered the service in Travancore, Cochin State Health Service. So we were posted to Civil Hospital Trichur, 2 of us. And from Trichur Civil Hospital, after 2 years service there, I was posted to Pure Central Jail as Jail Medical Officer. So I joined the service in 55, jail service. So nearly 2 years of jail service. In 57, I joined the radiology department of the Trivandrum Medical College as tutor in radiology. Now, as tutor in radiology, we were selected for postgraduate training from 1958 to 60. So I got the selection for the postgraduate course, and I joined the Madras Medical College Radiology Department in 1958. It was a 2-year diploma course. I completed the course in 1960 and joined the Trivandrum Medical College Radiology Department. After about 1 year in the Trivandrum Medical College, I was promoted and posted to Calicut Medical College. Now, I worked in Calicut for about 3 years, 61 to 63. And according to the rules in those days, we were to get the postgraduate degree course also. For our promotion, it was necessary. So I opted for MS and joined the Trivandrum Medical College Surgical Department in 1963. And 63 to 65, I completed the MS in Trivandrum, and then I was posted to Kottayam Medical College. That is 65 to 68, I worked in the Kottayam Medical College as assistant professor of radiology. Now in 68 again, I was promoted and posted to Trivandrum Medical College Radiology Department. So 68 to 73, I worked in Trivandrum Medical College Radiology Department, and from 73 again, I was promoted and posted to Kottayam Medical College as professor of radiology. Now from 73 to 86, 13 years, I was in the Kottayam Medical College. In fact, I organized the Department of Radiology and the Cancer Department, etc. in the Kottayam Medical College. And 86, I retired from Kottayam Medical College. Now, my interest in Siddha system started in 1983, where when a patient was declared incurable by the chest department of the Kottayam Medical College, was cured by a Lada Guru, that means Siddha physician, Siddha Vaidyan. And it was an eye-opener, and I wanted to know more about Siddha system, and when I went after so many Vaidyas and all that, collected so many books, and from 1983 onwards, I am practicing Siddha system also, along with my allopathy and other systems, Ayurveda and homeopathy, etc., with miraculous results. RCC treatment is most unscientific, and it is, I have written dozens of letters to RCC, different doctors. When they come to me, I wrote to them, I send a copy of all those letters to Secretary Health Department, it is Rajiv Sadanandan, including Paul Sebastian, Director, mismanaged case, totally mismanaged case. Why they are not prepared for a research in this field? When you know that it is definitely useful, it is curing patients, then why can't they associate themselves with this? See, RCC is meant for patients, not for our doctors there. That is what I don't like. And the minister must have the guts to do it. If you can't do it, you get out. There are people who are willing to do the research there. You opened up you know what happened in Nayanar's days? When I think M.A. Baby and Nayanar brought one Ayurvedic physician from Uttaranchal. He was given few beds and in the RCC itself, and he started a clinic there. But he was thrown out of the institution. You see, this is what I don't like. The institution is for patients, not for doctors, not for medical community. They have no voice there. If there is a good principle, good system that is effective, useful for the patient, it must be instituted there. For that you must have authorities who have guts to do it, because they are doing all useless things there, all useless things. The work they are doing is what is third-rate work. Because I was there in Trivandrum for about 5-6 years. I was managing, I wrote to Sadanand, I was managing single-handed all these patients. Of course, there was not so many patients were there, but I was single-handedly managing the whole IS for about 5 to 6 years, Kottayam Medical College, with excellent work, about 99% cure rate. And what is their result now? Hopeless. Because I am really sorry. Crores they are spending for that testing. And this chemotherapy, it is useless thing, and they are spending crores for chemotherapy. You know, this Geeta was the head of the Department of Medical Oncology. And this patient whom I told you about from Manargad, she was her patient. She had chemotherapy. And with a simple, 500 rupees medicine, she is cured. Siddha medicine, 500 rupees. She is cured. Just imagine a patient who was cholera bukke cholera bukke, the patient is totally cured. She is coming back. And at least that their eyes must open. Hopeless. I am really sorry to see the pathetic condition of these patients. They are in suffering like anything. ഭയങ്കരമായിട്ട് കഷ്ടപ്പെടുക പേഷ്യൻസ് RCC. Here Paul Sebastian, he removed the tongue of a 22-year-old man, boy. Removed the tongue. I wrote to him that his soul will never forgive you. He will be haunting you throughout your life, I said. Boy, 22-year-old boy from Trichur, his tongue was removed. Actually, the culprit was his teeth. Instead of removing the teeth, he removed the tongue. And he could not swallow, and he died within a week. Very pathetic condition, very pathetic, very, very unscientific. It is not patient oriented at all, the treatment that they are doing in RCC. No, you see, we know that all these things are good, this combination treatment is very effective in many diseases, including cancer. But there is no support or promotion or encouragement from the authorities. That way I am totally disappointed. Because if you know, once you know that a thing is good, you must try to encourage it. You see, we know that the Siddha system or the Ayurvedic system along with the allopathy system is used. And why can't they start this, encourage this system, this, in the RCC is supposed to be the premier center for cancer treatment. They can actually have it there itself. Lots of patients are there. There is good scope for research. Any type of patients are there. And if you combine this, you can at least improve the survival rate, cure rate, not survival rate, cure rate. Why can't they start it? Why the authorities are not encouraging it? I am really disappointed, really disappointed.
What's the solution?
Solution is starting the system, because I am prepared to give any advice, any amount of time I can spend for this, because I have treated thousands of patients in this field. Along with, I am an allopathy physician. I am not a Siddha physician, but I am doing Siddha for the last so many years because it is such, I find it such a useful, effective treatment. So I think ideally the best place is RCC, and you must select people who are interested in combining this treatment along with that. There is no point in having an adamant attitude that nothing out of thing other than allopathy in RCC. What is there? It is a government institution. It is not anybody's private property. You can have, because government, Ayush is a government policy. You can have the Ayush department there. I think the minister should take an initiative, and whether the director or the staff in the RCC are against this is not the question, because this is a treatment which is useful for the patients. Anything that is useful for the patients, their cure, their well-being, it must be instituted in RCC. It is not doctor's interest. If the doctors are not willing to work, they can go. So there are many doctors who are willing to work along with the Siddha physicians there. It must be immediately started in RCC, because I am thoroughly disappointed with the work in the RCC now. Thoroughly disappointed. My suggestion is, that is what I said, my aim is to educate the public, so that when a doctor suggests a treatment to a patient should be given a chance to question that. Is it the correct treatment? Is it the modern treatment? Can you have any treatment with retaining my breast? Because I am more concerned about my health. I am concerned about my breast. Is there any treatment where I can keep my breast in my body? And because a patient came and said, I said, Ishwaran organ. See, I won't give it up, because he has given us this thing. See, as far as a woman is concerned, breast is a very, very important organ. You can't just casually say you remove the breast. See, it is it's a very big issue, very big issue. So, if there is a treatment with retaining the breast, you should adopt that. Is there any treatment like that? I can guarantee, without touching the breast, I can cure the breast. I can guarantee. Any stage, any advanced stage. Of course, all my patients are advanced stages. All cancers, see, there is no any specific cancer. All cancers can be managed. See, cancer also is an immune deficiency disease, just like AIDS or any other disease is, because those who have strong immunity is not getting, they are not getting cancer. So it is an immune deficiency disease. So if you strengthen the immune system, you can get over cancer. That is my experience. Any cancer, any cancer. Osteogenesis sarcoma is supposed to be the most dangerous cancer of the bone. Can be easily managed with this method. Because all cancers can be treated. Because we are not treating cancer, we are treating the immune system. We are strengthening the immune system. And that is fighting the disease. See, I don't know why people don't understand the importance of immune system. And chemotherapy kills the immune system. Is to encourage all the systems. Because there is no monopoly. Health is not anybody's monopoly, you know. It is the joint work of all these systems. Because many patients recover with homeopathy. Very simple, costly, cheap treatment. See, if you, yesterday there was a patient, he had a swelling here. He went to the MVR cancer hospital because he is under my treatment, he has improved a lot except a swelling here. They said they will remove it. Anyway, you remit 1.5 crores, 1.5 lakhs for the surgery. That is what the first condition is. That is the first condition. So he is from Calicut. He came to me. I said, "Don't go there. I can cure it without any treatment." It is simple. But the first thing I say, I don't blame them because he പറയുന്ന surgeon, he is paid about 6 or 7 lakhs a month. His pay, because he has got his degree with after paying 2 crores. See, it is a vicious cycle. How can I ask a doctor who has spent 2 crores for his studies to do it free? Can't do that. Same. All cancers, see, there is no any specific cancer. All cancers can be managed. See, cancer also is an immune deficiency disease, just like AIDS or any other disease is, because those who have strong immunity they are not getting cancer. So it is an immune deficiency disease. So if you strengthen the immune system, you can get over cancer. That is my experience. Any cancer, any cancer. Osteogenesis sarcoma is supposed to be the most dangerous cancer of the bone. Can be easily managed with this method. Because all cancers can be treated. Because we are not treating cancer, we are treating the immune system. We are strengthening the immune system. And that is fighting the disease. See, I don't know why people don't understand the importance of immune system. And chemotherapy kills the immune system. Alcoholism, smoking, all these things will damage the immune system. And normal immune system is the function of your bone marrow, blood. So if there are certain drugs that will damage the immune system, like this ഇതുണ്ടല്ലോ നമ്മുടെ കോഫ് സിറപ്പ് പോലെയുള്ള syrups, allopathic drugs that will damage the immune system. So if you do a very natural life, don't resort to this non-veg diet. Depend on pure vegetarian diet. If you consume 2 or 3 glasses of curds a day, your immune system is perfect. According to Ayurveda, there are 3 types of food: Sattvigam, Rajasa, Tamasa. Sattvigam is the food, good food. Rajasa is the non-veg food. Tamasa means stale and valichadam pudisokka. So, if you take fresh food, because your body is your food, nothing else. You don't get anything from elsewhere. What you eat is your food. So, if you eat good food, you have a good body, that's all. It's very simple. There is no logic in this. So, that is a must, good food. For that you have to take fresh food. I have treated about 4,000 patients have come to my service in this 35 years. I am very happy, extremely happy. I am really sorry that there is nobody to continue this work, because I have been asking many allopathic doctors to take up this also, because allopathy doctors, because they have a very detailed training in basic medicines. So it is not the Ayurvedic or the Siddha physicians, but allopathic doctors should take up this research in these fields. There is immense scope for this, because in the field of cancer, the basic principle, there is lot of difference between allopathy and Ayurveda or Siddha, because in fact Siddha system is not treating cancer. Siddha system is treating the patient's immune system. Immune system is boosted, so that patient is controlling the disease. That is the difference between, when allopathy they have what is called the chemotherapy for this. Chemotherapy destroys the immunity. First thing the chemotherapy does is it will damage the immune system. But here, whereas in Siddha system, it stimulates the immune system, and the immune system of the patient controls the disease, and that is the more scientific method, making the patient fight the disease, and that is what the Siddha system does. So recently one gentleman came and asked me, what about the, I said, I am not treating your cancer. I am not bothered about your cancer. I am bothered about you, your immune system. So I am treating only your immune system. I am not treating cancer. We were surprised. It's a basic difference between allopathy and the Siddha or Ayurveda. Ayurveda, it is Ayurveda. It is science of life, not disease. Ours is disease-oriented. We diagnose the disease and treat the disease. But here Ayurveda and Siddha, it is not the disease at all. They don't bother about the disease, they bother about the patient's immune system. That is the basic, there is a basic difference in the concept of Ayurveda and allopathy. And actually this is more scientific than allopathy.